All right, so we're going to get started. I thank you all who were in the waiting room waiting for us to get started today. And I welcome you to our Parent Power Session, SEL Matters Too. We have three extraordinary speakers today who are going to be guiding us through this discussion, including providing for us a working definition of SEL and what we mean by that, and what that is in the context of our students in independent schools. I want to start just by giving you a little bit of background about myself. My name is Maria Underwood. I am a parent of seniors at independent schools. They will be graduating in just a few days. And so I personally know what it is to have gone through the journey of going through the admission process and the journey of being enrolled and accepted and enrolled in an independent school, and then the process of learning in that environment for children of color. I want to start by introducing Rachel. Rachel Hennis. Rachel, am I pronouncing your last name correctly?
You are, actually.
Okay, perfect. Rachel Hennis is a social worker, a mom of two young children, and the director of Hallways, a not-for-profit program that promotes social and emotional capacity building in independent and affluent school communities. Through her work at Hallways, Rachel has conducted hundreds of interviews with independent school students, administrators, and educators to understand the particular social and emotional challenges and issues that young people in the New York City independent school community are navigating. Using these learnings, Rachel consults with schools to identify and transform harmful norms and practices in the service of promoting equity, health, and well-being. So Rachel is absolutely the perfect person to be here today with us to speak about SEL in independent schools. We also have Dr. Kimberly Williams. Dr. Williams is a pediatric neuropsychologist and clinical psychologist practicing in Long Island and Brooklyn. She has expertise in the evaluation of giftedness, academic and learning problems, as well as psychological concerns, ADHD, autism spectrum disorders, anxiety, depression, oppositional behaviors, developmental delays, and social deficits. She consults with professional children and their families in home and on location. Dr. Williams is also an experienced psychotherapist who provides empirically based behavioral interventions for children, teens, young adults, parents, and families. She regularly consults and provides workshops and training in issues related now to COVID-19, the crisis and aftermath, as well as special education and parent advocacy. Dr. Williams is a graduate of Spelman College. She's also earned her Doctor of Psychology at the VCPCP, the College of William and Mary, Norfolk State University, Old Dominion University, and Eastern Virginia Medical School, a mouthful. Advanced training also through Cornell at NYU Child Study Center, where she served as a clinical instructor at the Department for Child and Adolescent Psychiatry at NYU Langone Medical Center. Also someone very, very experienced and qualified to speak to these issues today. And last, but certainly not least, Blessing Uchendu. Did I get it right?
You're good.
Okay. Close, but no cigar, right? Okay. Blessing is a licensed clinical social worker with more than 10 years working in schools and community-based organizations. She has successfully developed and implemented programs designed to support youth development and staff capacity building in both private and public education settings. She formerly worked with Hallways as a program manager implementing substance abuse prevention and education within the New York City independent school community. Currently, Blessing runs Freshwater Counseling and Consulting, a teletherapy practice providing individual therapy for adolescents and adults in New York City, with the belief that individual wellness is deeply connected to our interconnectedness as human beings. Wow. So wonderful to have all three of you. So as you know, before I turn this over to our wonderful speakers, our conference goal today is really that parents and families should be inspired, and families of color should be inspired and empowered in culturally responsive ways through their independent school journey and through their lived experience to really provide expertise and a commitment to educational excellence and educational justice in the environments and settings of independent schools. So I am going to mute myself and to take off myself from the webcam and turn it over to our speakers. And if you have any questions, I am going to be monitoring chat. So please go ahead and put your questions in chat. The way that we'll proceed is that our speakers, Rachel will start us off, and our speakers will engage in content for the next 15, 20 minutes. We will definitely honor the last 10 to 15 minutes to really take your questions and have a real authentic chat and conversation. But if for some reason we don't get to your questions, please make sure that they're in chat. We're saving chat. And we're recording the session as well, and we will be able to answer those questions offline. So, Rachel?
Great. Thank you so much for the lovely introductions, Maria, and welcome to the folks that are joining our session. I'm really honored and happy to be here with you all and to be on a panel with Blessing and with Dr. Kim. Is really just a pleasure, and to have this conversation. So I, just briefly, a little bit about kind of how I got into this work with Hallways. My background as a social worker, I had has been particularly in gender-based violence prevention and working in public schools and working mostly with Black and Brown communities. And through my work, my journey into understanding my own whiteness and kind of what my role is, came to a place of wanting to be part of an independent school community, knowing that this is kind of the bastion of whiteness and of white affluent culture, and the harms the opportunities for sure, and the harms that produces. A lot of what Dina was speaking to so beautifully and powerfully before is a lot of what our team has kind of discovered and uncovered as we've been working in these school communities. So my background is in prevention, and particularly looking at how the cultural norms and context that we live in impacts our behaviors and creates violence. So with that, what I really want to have a chance to kind of start us off with today is talking a little about what is social emotional learning, why is it so crucial for all young people, and what Hallways, what we've learned working in the independent school communities, looking at how social emotional learning is impacted within those communities. So when we look at social emotional learning and think about it, we're looking at kind of the core building blocks and skills, life skills of what help us to be healthy in the world and in ourselves. So things like emotional regulation and self-awareness, social awareness, decision-making, relationship skills, these kind of core building blocks of our humanity that help us to have relationships, to weather storms, all of that. And we know that there's been a lot of research over the last 10 to 20 years looking at the cultural context of affluence and how within affluent and high achieving school settings, we see a lot of, often of course, academic rigor, a lot of, path towards Ivies, and the flip side, a lot of stress and anxiety, and the kids and young people in these communities can have about 2 to 3 times the rates of stress and anxiety and mental health issues as peers that are not in these communities. And why is that? What is it about the cultural context of affluence that leads to that? And what that can often be about is the kind of the intense pressure that young people face in independent and affluent communities that can take the focus off of building these core social emotional skills. And so in our work, we've done a lot. When we've come in, what Hallways does, we do workshops and trainings within independent schools to help prevent harm, to help prevent all different kinds of problematic behaviors, and to improve the norms and the experience of school for all children. And so when we come in, the first thing that we do is an assessment, and we look at what we do surveys and we do focus groups, and we try to understand, like, what are the risk and protective factors in this particular community? What are the things that are strengthening for the young people, and what are the things that may make them more vulnerable to stress, anxiety, substance use, various microaggressions, various behaviors. And what we see within our own research mirrors a lot of the larger research and a lot of what Dina was saying. And I want to focus specifically on what we've learned about what students of color have had to say in their experiences within these communities. So overall, I want to start with kind of the protective factors. So in all of our interviews and our anonymous surveys and our focus groups, kind of the themes that we've amalgamated from over the years, we've learned that we found really strong levels of parent support amongst students of color. So feeling like their parents care about them, support them, encourage them, spend time with them. That's been a real strength in a theme that we've found. We found a theme of empathy, and students of color reporting, and faculty reporting also high levels of thinking about others' feelings, understanding where people are coming from, which is wonderful, and something that makes us pause in the context of a white environment, how much young people of color are having to make sure they're thinking about what other people, what white folks, particularly white teachers, white students, are thinking, and having to understand where they're coming from as part of survival. It's a strength, and obviously it's a burden. And also a strong sense of identity, of kind of reporting, like, I know who I am and who I want to be. I feel clear about my goals. So these are some of the things that we've learned over the last several years as protective factors. In terms of risk factors, we've found kind of over and over, and we work with a lot of different schools in the New York City area. So this is kind of looking at all of the research we've found together. High levels of microaggressions every day that students of color are experiencing, a lack of kind of understanding overall from white peers and adults, understanding whiteness, understanding white supremacy culture, understanding different lived experiences. We found higher rates of perfectionism than for students of color than for white peers. So of feeling like they need to be perfect, of having rigid ideas of self-criticism and being good enough. And lower rates of feeling supported by the school and feeling a sense of belonging. And also of feeling like they have the skills they need to manage the stress that they are experiencing, right? So when we think about all of this and the psychic toll that Dina was talking about in the keynote, we take all this information to kind of really give schools a picture of what the environment is feeling like, and therefore what we need to be doing. And so I want to just talk briefly about kind of what this means for parents, and for thinking about individually kind of what it means, and thinking about the institutions that we are that our kids are in. And so I think for parents, we talk a lot about, with all of our work that we do with parents and with educators, first looking at kind of how this shows up in ourselves. So looking at perfectionism and kind of what that means for us, how to help young people, separate their value, like the institution that teaches that, the institutions teach them that their value is in what they produce and what they achieve, and not who they are authentically. And how do we counter that and do countering, messages and grounding in kind of our inherent value. And through that, kind of helping to focus on effort rather than outcomes. And some of that can be grounding. We also work on, helping practicing self-compassion when we are having the tapes in our head that tell us that we're not good enough, that we're not doing enough, kind of that you know, people are always judging us, kind of how to reframe some of that. So that's some of the individual level. From a institutional level, what after kind of many, you know, years of doing this work and thinking long and hard about SEL, social emotional learning, for parents that are in institutions, in independent school institutions, or reflecting on that, some of the things that I would recommend that parents and families look for is whether social emotional health is a priority in the school. Is our students, you know, having to get their social and emotional learning during 40 minutes of lunch once a week when, you know, they also are supposed to be eating pizza? Or is this something that is incorporated into the curriculum thoughtfully and is really seen as a goal, how all the young people in the school are doing, particularly students of color, socially and emotionally? Is social emotional learning, is the health curriculum culturally responsive and social justice informed? There's transformative social emotional learning curricula. There's different ways that these skills can and should be taught. And if they're not being taught in culturally responsive ways, then that's something for us to be paying attention to. Is the school checking in with parents and family about how parents of color, families of color are doing socially and emotionally in the school? Are they hearing feedback and receiving feedback? And mostly what I think about as a white woman and a white person in these schools, in white institutions doing this work, is, are there conversations in the school, learning, training, investment of resources into understanding whiteness, into understanding how the culture reproduces itself, how it harms every child in the building, students of color and white children? Is there an investment in learning and growing in that way? As was said, you know, before, these schools were not designed for students of color. These schools were designed to reproduce white power and white supremacy. So that's an undoing process that has to happen. And is the school invested in that process? So that's some of what I would recommend that we think about as we're looking at different schools.
Thanks, Rachel. Something that kind of stood out from what you were sharing, because I think you did a really good job of talking about the work that Hallways did and that I joined you in doing for a brief moment in time.
That was wonderful.
It was really, really transformative and helped teach me a lot about what young people are facing in these school environments. And I think a lot of what you pictured, like while I imagine that a lot of you all as parents and guardians of young people are here because you're really excited about the opportunities. But I think the picture that you've painted, Rachel, and the picture that I observed at the time I worked there is really sobering. And it sort of helps me think a lot about why there's such a strong case for social emotional learning. I think a lot about, and this was said in the opening session with Dina and Gina, about families, particularly families of color who are coming to independent school environments, are coming because they want the best opportunities for their young people, and have a sense of what this access might be able to give them, right? And what I always go back to is social emotional learning isn't an add-on, but it's actually quite essential for your young people to be able to succeed in the ways that you're wanting to. Because social emotional learning is a more new field, many of you all, myself included, while I like to think I'm still relatively youngish, I did not grow up with SEL in schools. Grew up with immigrant parents who I don't even think they still know what that means. And so a lot of my learning and understanding now is framed around how can we set students up to not only be academically successful, but also be their authentic selves, to navigate the world, their mental health and relationships in a more ideal manner. And so this is why, echoing some of what you've shared, Rachel, this piece around equipping them and ensuring that they're set up, SEL is foundational to that. One other thing I would add is that, particularly for those of your children who are adolescents, I think all stages of development are important, but the hormonal changes and the vulnerabilities that occur within adolescence I can't emphasize how important that time is. I was formerly a school social worker, and so working on the front lines with young people and understanding that for them to be able to show up in the ways that I know that you all as their parents and guardians want them to, that social emotional learning piece really needs to be attended to. So I want to pivot though, because I think Dr. Kim has some really great things to share with us about cognition. Dr. Kim?
Rachel and Blessing, thank you so much. And good afternoon, everyone who's joined this series. This is fantastic. It's such a necessary and important topic this afternoon. It's unique, and I'm coming at this from a little bit of a different angle. I'm a psychotherapist and a neuropsychologist. So I'm really looking at the neuroscience and the brain behavior behind, cognitive abilities and how this impacts our students educationally. And in my work, I will say that families come to me for child psychotherapy, and 100% of the time, their family issues and school-related issues and challenges in which there is a social and emotional component to the environment that is impacting whatever the question of concern is. And then when families come to me for testing and assessment, the neuropsychological aspect of it, 100% of the time, the recommendations that I make require some social and emotional awareness and strategic implementation. So it's very true of families of all cultures and ethnicities. It is very true in the Black and Brown communities that we really do need to address the social and emotional components of our lifestyle. I'm sitting here, and as I'm thinking about how tumultuous this week has become, I'm wondering in my mind how many students of color are going to log into their virtual classroom in the morning, and how many teachers have adjusted the curriculum or have words or some level of support to even address what's been going on all week and this weekend.
Yeah.
And, as I think about it, it is sobering that I bet it gets glossed over. If anything is said, it's perhaps either glossed over or it's become, well, if we don't say anything about it, it won't be an issue. So, it's just incredibly frustrating as we think about it. In my work, when families come to me, there's common concerns. And when a family wants an assessment for their child, it kind of goes two ways. A parent will come to me and says, well, the school says my child needs an assessment because they're not working up to the standards of the school. The parents say to me, I feel a bit blindsided because, we recognize there were some minor issues, but how serious is this? The parents feel confused because they're wondering, has the school waited until things are irreparable? And is this some type of way to subtly counsel my child out of the school? Another aspect of their concerns is some parents come to me and they say, well, I recognize my child's strengths and challenges. I've always known that my child learns differently and they require a level of support or accommodation. However, the school doesn't see it. I'm worried that the school is glossing over my concerns and they're saying, it's fine. Your child is good enough. They don't have to be the best. When you know as a parent that somehow your child is missing the mark and you want their support. Parents worry that their child's abilities are underestimated. They worry about perhaps the school is holding back resources to accommodate their child. They may recognize that other children, perhaps white children, are getting accommodations and they want their child to have a level playing field. They're worried that their child is going to miss opportunities for advancement because the school is just unwilling to recognize that their child is bright, but they also need support and they don't want the opportunity to be limited. One thing that really resonates with me is something that Rachel shared about affluence and the challenges that within the wealthy school communities and environments to address mental health needs or learning differences. Back in 2007, I published an article in the Journal of Abnormal Child Clinical Psychology about the era of affluence and its discontents. And the overarching theme of that is that children in wealthier communities are not the healthiest children with regards to mental health. There's so much work and research put into communities, in urban communities for children of color, mental health. And that's fantastic. But when you take these children of color and you put them in a wealthier community or a parochial school, an independent school with such a large endowment, there's focus on education and STEM and science, but the mental health and wellness is something that's put on the back burner for, as you say, should this be a lunchtime conference? Should this be, one teacher conference at the beginning of the year? Where do we fit this? We don't want to put too much emphasis into this because we don't want this to be such a big deal. We don't have those issues here. So that happens. In the past 3 weeks alone, virtual school, I'm certainly inundated with parents who have concerns about virtual school and online classes. I work with many families of color whose students do attend independent schools, and they've shared a few things with me. There's a parent who came to me and said, we had to pick up some learning packets for the virtual on-school programs, and I feel like my child's packet was missing something, was missing an element or a document. And as a parent of color, I'm trying to figure out what I should do. The teacher says, well, you know what, why don't you contact another parent and see if you can get the missing document? And the mother shares with me, as a parent of color, I feel awkward contacting another parent to get some information that I should have. Am I making a big deal of this? In scenario 2, it happened about a week ago. A parent came to me and said, and my daughter was asked to do some research, and she decided to do a paper on the desegregation of public schools in New York City. And her faculty advisor suggested that, that's a very large undertaking, and perhaps we should scale back that project and select something more manageable. In scenario 2, there's a parent who says, whenever, she is a kindergartner, and whenever the curriculum subject matter focuses on racial inequities or discusses cultural contributions, particularly in February, my daughter's peers stare at her during the discussion, and they seek her out for clarification as if she's the expert on all things Black. And finally, I have a parent who shares that, my 9-year-old daughter demonstrated some lack of organization during a virtual class assignment on a Zoom screen with other students. And the teacher asked her, hey, let's see what the other girls are doing. Ladies, how would you tell, I'll make up a name, Ashley, to get organized? And so my daughter sat quietly while her other non-Black 10-year-old peers gave her a lesson on how to get organized. So, with this, parents have come to me for therapy, for consultation, for assessment. And often, sometimes even after 9 hours of assessment, we get to the end of this and I can explain a child's strengths and challenges, which inevitably ends up following up with a meeting with the school with recommendations and supports and accommodations, for a child. And these prevention and intervention methods certainly do include social emotional learning. And this is a factor as a whole, but often miss the mark for people of color. Today, we really need to truly highlight for parents and those professionals employing this, that it's important that if we're going to work on social emotional learning with the whole child, we certainly need to understand how it impacts children of color. Our culture should not be demonized in this with the whole, Black is not a bad word. It shouldn't be ignored or discounted or trivialized or rushed through. We need to recognize the complex issue of problems in education. Sometimes I think a lot of schools want to address it, but they address it in such a simplistic way and don't understand the cultural layers and complications of it. I think what's very important is that professionals that are implementing teamwork and strategies of social emotional learning should be professionals of color, but my goodness, should not just be limited and exclusively the domain of the Black and brown faculty, because everyone needs to have a role in this. You can't stand by the wayside and pass it over to the Black and brown faculty if we're really going to consider the whole child and implement this in the most effective way. And again, just, you know, high quality multicultural content starting at pre-K all the way through 12th grade and through higher education. Those of us who are trained educators and psychologists and social workers, this should be, you know, not limited to a half a course training, you know, by the only Black professor or brown professor, you know, in the faculty. And I think the last thing I want to say is in my practice, and I'm in private practice in Brooklyn and Long Island, and, you know, I love that professionals in independent schools, you know, say, oh, we know a Black neuropsychologist and we're going to refer you to this Black neuropsychologist because they may have a sense that this situation requires some cultural competency. Mm-hmm. And I love that. But also note that when I'm finished with this assessment and we recognize that there is a social and emotional aspect here that requires a different level of understanding at your independent school, that I'm going to pass that recommendation right back over to you. And now you're going to have to establish some changes, some aspects of the curriculum may need to be changed, or some levels of support. And this is not going to be an easy fix. And so I want to definitely help you understand that there needs to be some established changes here. It's not that, oh, we sent her to a Black or sent the child to a Black neuropsychologist. Now everything's all fixed. So come on back to our white school.
Well, blessing, Dr. Kimberly, Rachel, thank you so much for your comments. You certainly have given us a lot to think about. I want to end, because we don't have a lot of time, and maybe if you could just sum up. There were two big questions that came in chat. One was, Rachel, when you were talking earlier about the trauma, there was a question about whether that trauma occurred, whether there was a gender distinction in that level of trauma. And then you each have addressed so many suggestions, right? Or examples, Dr. Kimberly, that you just gave of a lot of different parents giving you scenarios of microaggressions or macroaggressions or assaults, if you will, that they've experienced in the school, and sort of how to balance the world as a parent of color. I wonder if we could both think about, just give us like one, as parents, if you had to give one suggestion, and maybe each of you could take a different developmental level. If I'm a parent starting this journey at the early childhood level, what might be something that I need to think about as a parent going into this environment in terms of SEL, that I might need to be cognizant of? If I'm a parent in a middle school where my child is starting, blessing, as you talked about, that early adolescent period and that development, or I'm a parent in upper school, upper division, is there a distinction in trauma based on gender? If we could maybe just give one high level, and I'm going to make you stick to something really brief and quick, but one high level recommendation or support that as a parent in this session, what's a takeaway? I don't know who wants to start with what.
I would say that as a parent, it's important to be visible. It is important to establish a collaboration with other parents of color within that particular school, and to meet regularly and to connect with faculty and administration and let them know, you know, we are visible, we are aware, we want to work with you. And that is just, it's very important to recognize our children and that we're going to work together to systemically change things.
Thank you.
The suggestion I have is asking about what SEL looks like for the adults in the building. So I'm not a proponent of anything being wrong with children of color and there needing to be things that fix them. I actually think that a lot needs to be done on institutions being responsive and changing. So I think asking schools and holding them accountable, these educators cannot show up to talk about the things that matter, like what's happening right now, if they themselves haven't interrogated their own biases and who they are. So that's what I would offer up.
Mm-hmm. Absolutely. In terms of the role of gender, being brief on that, Blessing knows what a challenge that is for me. But I guess I would just, I mean, yes, I think there are different, when, you know, in particular within the cultural context of affluence and the research, we do see that like anxiety, perfectionism, like the rates are even higher amongst girls, and then girls of color. White girls and girls of color, we see that, you know, kind of in the research, and with boys overall, we see more trauma kind of showing up externalized in the research. So in terms of like adhering to traditional gender norms and feeling like they have to be tough and stoic and all of these things. So we do see like the gender socialization that we all receive playing out. And I guess I would just say that I think with all of it, it's like kind of looking at, you know, what your child's particular tendencies like individually, and then the kind of cultural, institutional, societal messages and training that we get, and how that mediates or how that, you know, mediates or emphasizes those norms. So there is certainly a role of gender. Obviously, the way that mental health, you know, is related to or seen, and how bias plays out is very gendered when we're looking at students of color and who gets in trouble and what kind of, you know, what punishment looks, all of the different ways. So there's, I know, many conversations we could have about it, but I think overall, yes, traditional gender stereotypes play out, and yes, we do see mental health issues play out in particular ways, based on gender overall.
Thank you all again. This was really, really important, especially in light of the week that we've all just lived, the recent months even, that we should acknowledge of what's been happening. So this was really helpful. Thank you. And to those who may have put questions in chat that we did not have an opportunity to get to, we promise we will respond to those offline. But I do need to let you go so you can get to your next parent power session. So thank you again.
Thank you.
Thank you. Thanks so much.
Bye.
I'm going to
Yes.
run to the bathroom for a second.
Maria, our next session starts at what time?
Like now, basically. It's been, I think it's actually, we have 5 minutes. So,
Yeah. Okay. So at 3.
let's say I'm going to open up and let people in from the waiting room about 3:52 around there. So at about 3 minutes or so, I'll start letting people in. But we won't really start till I'm thinking 3:55.
Okay. That sounds good.
Perfect.
That sounds good. I'm wondering if there's a way too, Maria. I saw the chat because I don't know. I was having a hard time having a sense of the timing. I know that I like said not very much and then passed it over because I was like, are we starting questions soon? Is there a way to get a prompt around that? I don't know. Like when we should
Stop.
Yeah. What time is I don't know. Something about the pacing or spacing of the last one felt hard to.
It was. And I also think that was also my fault because we started a few minutes behind schedule, I think.
Oh, okay.
But so definitely when we come back, I'll make sure that both Rachel and Kimberly look at their chat, because I will send them, since we're following the same order, I'm assuming, I'll send them kind of a little note of like, be aware that this is the time you have so that you'll know, and we'll do it that way.
That sounds great. Thank you. gonna run to the
Hi,
right.
I'm back. Sorry.
Okay, go ahead. We're going to start. I was just mentioning to Blessing Rachel, we'll start at about 3:55.
Okay.
And I'm assuming that we'll follow the same order. I'm going to send each of you in private chat the amount of time so that you know.
Great. Yeah.
So that I think will help structure it so that everybody feels, and then we still are not rushed at the end
Great.
to take in, because we have a lot more people in the waiting room now than we did for the.
Okay. Yeah, that'd be great. And I'll pay more attention to the
No, I
chat
know
box
it's
too.
hard.
So
It's not a lot of time at all. Oh, I'm sorry. I just muted you, and there you go. Sorry.
I
meant to mute myself, and I muted.
okay.
Sorry.
I'm gonna just take a couple notes of like where to also cut down a little to help with that for myself.
What's up, Rachel? The opening session was great, right?
What's
I
that?
ended up making it the session with Dina.
Oh, so amazing. I just thought it was just really beautiful, so sincere. And yeah, I did end up making it. I was really glad I did. How are you doing?
I'm good.
Wonderful to see you.
Likewise. I'm good. Boxes around.
I mean, the little sliver of apartment I'm seeing looks wonderful right now. It looks very homey, and you did a nice job.
Getting to there. My roommate did a lot because I'm moving into an established place, but so many boxes yesterday. Yeah.
I mean, what an intense moment to move.
Yeah, I know. I was not excited about that, but I'm like, we're going to be in the same state, whether I'd done it now or June, I imagine
Yeah.
We will not be corona free by then. So I'm just whatever. So.
Are these friends that
Yeah, I moved in with a friend. So it's a more flexible situation.
Okay.
So it's good. I think it's good to have a different sense of community during this time as well.
Yeah, for sure.
Yeah.
And are you still, we have obviously a separate catch up to do, but are you still, okay, I got my, are you still with,
International?
International, yeah. You are?
Yeah,
okay.
but I just am hoping to pivot to doing the practice full time.
Right.
So, to me, I have 405 to 415. Okay.
Yeah.
Yes, but I would love to be doing this. I was thinking, and hearing these conversations makes me be like, I want to do this full time. So.
Oh yeah, well, I'm sure you will make that happen. I have no doubt.
I hope so. So yeah, but this fires me up.
Good. Yeah, absolutely. Absolutely.
How are the boys doing? Yeah.
Blessing it is. I mean, they're doing great overall. It's just like, this time is just so, in my shirt, I'm like pulling the other way to get it even. They're doing great overall. I think like Nathaniel is just, he couldn't be happier to have like both of us around and spending time with him. And he's just, he's just such a ham. You would really appreciate his little personality. What's that?
Is he like his mama?
Yeah, he's a bit like his mama and his daddy. It's like he's like let's party, let's do. He like wants to talk to everyone. He wants to like Noah's still Noah, my sensitive little guy. But he's.
I'm going to start to let people in from the waiting room because this time we have a much larger group. So we have 13 people. That way I can get into the intro and we can definitely get started. Each of you should have seen in chat the
Yes.
amount of time approximately. That way we can at least, and then I can jump in with questions, at least one or two at the end, before they have to move into the independent school fair.
Marie, that intro for me is lovely. It's so long. You do
I know.
not have to do that.
I'm gonna shorten each of
I don't
yours.
even know where that came from. It's so long.
I'm going to shorten for everyone just to give you all more
Okay.
time, because I acknowledge how difficult it is to share what you want to share and need to share in just that little bit of time. And as it is, I think I've given each of you only 10 minutes. So definitely I'm going to shorten the bio, but each of your bios is absolutely, and I'll mention that they have that in the program as well. So let me let people in. And now we have 14 people in there. So they're coming in now. Okay. Hello, everyone. I know that some are just still trying to join the session. Most of you have joined us now, and I appreciate and thank you for your patience in waiting in the waiting room. We just wanted to make sure that we had appropriately transitioned from our first parent session to the second parent session, which is, of course, SEL Matters Too. And given this morning's keynote discussion with Dina and Gina and all of the events of this past week and even these past 3 months and before then, it's certainly something we all want to talk about as parents, as guardians of students venturing into the journey of independent schools or living it right now. So I'm going to quickly pivot to just sharing with you a little bit of background, a little bit of very brief bio of each one of our wonderful speakers for this session. Again, if you were looking to be in the session SEL Matters Too, you're in the right place. And we're going to honor your time today, because I know that many of you are interested in moving from this session to visiting some of the independent schools in the school fair. So we're going to have each presenter share a little bit about their background and their work as it relates to SEL and as it relates to obviously students of color in independent schools. And then I will try to take a few questions at the end. So if you have questions, whether it's now or at any point in the presentation, please put them in chat. And any questions we're not able to get to, we will promise to offer a response and get back to you offline. So please make sure to use chat in that way. You all should be muted upon entry, and I don't believe, visible to each other, but you can be if you like. And I'm going to start by just sharing with you, obviously you see on the screen, my name is Maria Underwood. I am a parent of 2 teenage young adult women who are about to graduate from independent schools. And so this whole journey of traveling through independent schools and institutions that are predominantly white for my 2 Black girls is certainly something that's key to my heart, and discussing SEL in terms of a cost of this investment in this world is also something that's really, really dear to my heart. But let me start by introducing Rachel, who will be our first speaker for this session. Rachel Hennis is a social worker, a mom of 2 young children, and the director of Hallways, a not-for-profit program that promotes social and emotional capacity building in independent and affluent school communities. But through her work at Hallways, Rachel has conducted hundreds of interviews with independent school students, administrators, and young people in both the New York City independent school community and how they navigate that experience. And we'll actually be referring to some of the learnings that have come out of the program or her work in Hallways. So Rachel, thank you so much for being with us today. Blessing will follow, and Blessing is a licensed clinical social worker with more than 10 years of experience working in schools and community-based organization. She actually hails from the same program as Rachel and worked with Rachel at Hallways, but she brings to the discussion a really nice juxtapose of both the work in the independent world, independent schools, as well as the public education setting. And currently, Blessing runs Freshwater Counseling and Consulting, a teletherapy practice providing individual therapy for adolescents and adults in New York City, with the belief that individual wellness is deeply connected to our interconnectedness as human beings. And last but certainly not least is Dr. Kimberly Williams, who is a pediatric neuropsychologist and clinical psychologist practicing in both Long Island and in Brooklyn, who has expertise in the evaluation of children that run the gamut from giftedness to academic and learning problems to psychological concerns such as ADHD, as well as autism spectrum disorder, anxiety, depression, oppositional behaviors, and social deficit or delays. She has consulted with numerous organizations, currently consults and provides workshops and training in issues related to COVID-19, the crisis of the pandemic, as well as the aftermath. So we welcome her expertise as well from that medical lens. So we'll have Rachel start. And again, I remind all of the participants who are with us to please make sure to put your comments in chat.
Thank you. Thanks so much, Maria, for setting us up and introducing all of us and holding this virtual space, this session. Thank you all for joining, and it is an absolute pleasure and honor to be able to speak with you today and to be on a panel with Blessing, who I've had the absolute privilege of working with closely, and Dr. Kim, who I'm having the privilege of getting to know during this experience. So thank you all. I'm going to try to keep my comments brief and just want to focus a little bit on the work what we've learned, what I've learned through my work at Hallways. So as Maria mentioned, Hallways is a nonprofit program in New York City. We work with in many schools in the independent school community, looking at what are the risks and risk factors and protective factors that face young people within these communities based on